Hi, my name is Dr. Sunita Puri, and I am the Medical Director of Palliative Medicine and Supportive Care at the Keck Hospital and Norris Cancer Center of USC. I'm also the author of That Good Night, Life and Medicine in the 11th Hour. And I wanted to share a couple things with you today about the importance of advanced care planning and about what palliative care is and does and how we in the field support advanced care planning. So I think particularly now amid COVID and all of the uncertainty that this pandemic has brought about and the vulnerability of everybody, regardless of age or health status, to the virus, it's become more important than ever to start thinking about and talking with your family and your doctors about what you would want for yourself if you were very sick. And it is really hard to contemplate things like sickness, mortality, suffering, and death. But if we don't start preparing ourselves and our families for what we will all face at some point, then we don't really give ourselves the best chance of having the dignity and comfort that we might want when our time comes. And talking to your families about what you would want for yourself if, for example, you needed to be on a ventilator long term. What would you want for yourself if you got so sick that certain parts of your quality of life would never return? Having these discussions and designating a person in your family who you would want to speak on your behalf and writing down who you would not want to speak on your behalf gives us as your doctors and medical team the best chance of honoring your wishes. And it's a real gift to your family if they know what you would want for yourself so that they don't have to guess. Because whenever someone is very sick, the emotions surrounding that can make it really difficult for families to think about what their loved one might actually want, not what they want for their loved one. I think talking with your doctor in clinic, and that could be your primary care doctor, it could be your oncologist or cancer specialist, it could be the doctor who takes care of your heart or your kidneys, whoever it is that you trust and who you feel knows you and your health situation well, that's somebody to reach out to start discussing these questions once you've talked with your family. Because all of us in medicine and nursing want to be able to honor what's important to the person we're taking care of. And you have that power to define what you want for yourself and what you don't want for yourself if you get really sick. Palliative medicine can be a very big ally in these conversations because what we do is we're an interdisciplinary team focused on treating suffering in all its forms for someone facing a serious illness. So a doctor, a nurse, a social worker, and someone from spiritual care work together to help you define what's important to you when you're sick and to help treat your pain, shortness of breath, nausea, and any other symptoms that arise from your disease or from our treatments of your disease. And when you get palliative care, you can still get cancer therapy or dialysis or advanced therapies for your heart. So you're not making a choice between treatment and palliative care. You're actually getting a palliative care team attending to your quality of life and supporting you and your family as you get the medical treatments focused on your disease. And palliative care is distinct from hospice because hospice is a beautiful program offered to people in the last 6 months of life when they are generally not getting certain medical treatments. And hospice is a type of palliative care for that patient population. So although palliative care and hospice are similar, they're not the same. And I encourage everybody to think about involving palliative care when you or your loved one is very sick, because we're really specialists in quality of life, including treating symptoms and helping you plan for what you might want in any scenario that may come to pass.